May is National Stroke Awareness Month, the time to get educated about the warning signs of a stroke and how to prevent it. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Brent Burrows, neurologist at the Queens Medical Center, West Oahu. Good morning, Dr. Burrows. How are you doing this morning?
I'm doing well, thank you.
Now, first off, what is a stroke?
A stroke is your brain's equivalent to a heart attack. There's been an issue with blood flow to one part of your brain, and that issue usually happens because of blocked blood vessels or even bleeding into the brain. A stroke needs to be considered a life-threatening emergency, and immediate medical attention is critical to prevent permanent damage or death. Stroke is the 5th leading cause of death in the United States.
Now, what are some of the warning signs of a stroke?
The warning signs of a stroke really are predicated on which part of the brain is not receiving adequate blood flow. So there's a variety of different symptoms that can occur, and there's a mnemonic that's been developed called Be Fast to help educate the public on what these symptoms are. So let me walk you through the mnemonic. So B is for balance. Is there been a sudden change in balance or coordination with the person? E is for eyes. Has there been a sudden loss of vision in one or both eyes? F is for face. Has the face suddenly looking different? Does it look crooked? A is for arms. Are the arms suddenly weak? Is one arm weaker than the other? S is for speech. Does the speech suddenly sound strange? Is it slurred? Are people not making sense with what they're saying? And T, the last one, is for time. It's time to call 911.
All right, there you have it. Be fast. So those are the signs. What should you do if you suspect that someone is actually having a stroke?
Good question. I think the most important thing to do is to call 911, okay? There is a medication or even a surgical procedure that can be done to stop debilitating stroke symptoms, but the time window in which those treatments work is very narrow. It's very soon after symptoms start. We know that patients that arrive by ambulance are able to get these treatments much sooner than patients that arrive by private car. And that's because critical steps are being performed in ambulances by our first responders that you cannot get in a private car. So number one, call 911, tell the dispatcher you think someone's having a stroke, where you are, and if you can, when you think they were last normal.
Now, doctor, is there anything that you can do to prevent a stroke?
Right. So the same thing that's good for our brain is the same thing that's good for our heart and our lungs. So healthy living. So avoiding smoking, vaping, alcohol in moderation, maintain a healthy weight, exercise 5 days a week, 30 minutes a day, and keep risk factors like high blood pressure, high cholesterol, and high blood sugars under control.
Now, to learn more about the Queens Neuroscience Institute, you can visit www.queens.org, click on Services, and then click on Neuroscience. Or you can just give them a call at 808-691-8866 for the Punchbowl location, or 808-691-3135 for the West Oahu location. Thank you so much, Dr. Burrows, for your time, and have a great day.